In this video, I'm going to be talking about panic attacks. So people get panic attacks, which are an advanced form of anxiety. And typically it's when people hyperventilate or they find it really hard to breathe, their chest is hurting, their heart beats fast, or their lungs aren't filling up with air properly. So they can feel nervous energy in their whole body, and sometimes they actually collapse or fall to the ground, or they feel that they're dying. It can get really extreme and they feel unable to do things or have to stop what they're doing just to try and deal with it. It can get really, really bad. So some of my clients can't leave the house when they get panic attacks. They suddenly can't do things they used to be able to do, like go out or, in shops. They can't go to work, or they get them when they're doing various things. So one of the things with panic attacks is it's a form of anxiety. We start with anxiety. It can develop into a panic attack. We aren't born having panic attacks. We're not stuck with them forever. Even if you've had years of panic attacks, if you get the right therapy, panic attacks can just stop and never happen again. Some of my clients actually get taken away in an ambulance because they think they're having a heart attack. So that's how bad it can get. And they can be mild panic attacks, they can be anxiety episodes, and they can be serious panic attacks where you're holding your chest and rolling around on the ground or crying and can't see a way out of it. It does make you feel very, very ill. It makes you tired and exhausted as well. And it makes you frightened. So some of my clients describe the panic attack develops into a fear, like fear of the fear. So even though they haven't had any recent panic attacks, they stop doing things because they're scared of getting a panic attack. So it becomes a fear of the fear, and that holds them back in their life. It stops them starting new jobs. It stops them doing new things. Some of them can't go on holiday. There's lots and lots of things that panic attacks can stop you doing. And sometimes you can get them multiple times a day. Now, one of the things that the doctors will say to you is either give you medication, they could give you beta blockers to slow down your heart, to keep it under control. They won't make panic attacks go away. It will just sort of calm you down a bit, but it's not going to make the cause of it go away. So if you did stop your medication, all of it will come back. It is a spike in the brain. It's the fear response in the brain, spiking really, really high. Your brain and your body feels under threat, and your body physical responses follow as if it's in real danger. These will happen even when you're not in danger, and they can happen at random times. This is something that a lot of therapists don't understand if they're not really used to treating anxiety, or they think they just need to calm you down. You can do CBT and breathing and distraction techniques, and it can make a panic attack calm down today. But if you're using breathing techniques just to calm you down, yoga, meditation, that sort of thing, chances are you'll get a panic attack tomorrow, because these don't cure panic attacks. They don't make them go away. It will just calm it down. And this is why it's out of control. And that's why you can't control a panic attack on your own. So these techniques are managing and coping techniques, and they aren't actually going to make it go away. The reality of a panic attack is that it can happen anytime. So a lot of therapists, in particular CBT therapists, they are looking for triggers, and they're saying, oh, what are you thinking about when the panic attack happened, and where were you, and what were your thoughts, and let's change those thoughts, and then you won't have a panic attack. But the thing is that a lot of my clients that do have panic attacks have them in their bed. They were fast asleep. They have them in the shower. They have them when they're watching TV with their children. They're not doing anything scary. It just happens. They can have a panic attack driving to work. So looking for triggers isn't going to solve panic attacks, because there are no triggers. The triggers are not these. These are just symptoms. And if all your therapists are dealing just with symptoms, then you won't be able to make it go away, because they're not dealing with the cause of it. Panic attacks and anxiety start because of a traumatic event, a fearful event, or something, an episode that causes shock in your brain. It could be something like somebody gets ill. It could be someone attacks you. It could be a relationship breakup. It could be your partner cheats on you. It could be bullying. All of those things can cause a panic attack. Your pet dying or getting ill. So you think they're dying or need to rush to a vet or something like that. So lots and lots of things it could be. Some of them are little traumas, some of them big traumas, but they can all develop into panic attacks if you leave anxiety too long, and it just develops into a fear. Then it develops into a fear of a panic attack. Even if you're not experiencing panic attacks, it can then hold you back. So the best way to get rid of a panic attack is to stop it happening in the first place. And the best way to do that is find out what caused it and then get rid of it. Some of you don't know what caused it. So a lot of clients that come to me, they have no idea what caused it. They've had multiple traumas, or they've had it so long they can't remember. That's what hypnosis is for. And therapists like me are able to use the subconscious mind. We use hypnosis. We use muscle testing, where your muscles can do involuntary twitches. We have gadgets sometimes as well that are like lie detectors that can see your heart going up and down, and we can tell exactly what it is that's caused it. So there are lots of ways to find out. You don't have to know at a conscious level. So this is really, really important to know. Some people don't actually know what caused anxiety or panic, and it's at a subconscious level. So I don't need to know, and I don't need to figure it out, because when I do therapy with my clients, we're uncovering layers, and it just goes, and I discover that. So you don't consciously need to know. Okay, so panic attacks aren't forever. They can be solved. I help loads of clients with it. So to recap, you're not born with a panic attack. They're not stuck forever. Even if you've had them for 10 years, you don't need 10 years of therapy. You can make them go away. We don't have to use coping mechanisms and distraction techniques. We need to get rid of it at a brain level, the thing that's spiking the fear in the brain, like this. We have this. The brain goes in and out like this when you're having a panic attack, but when you're in rest and digest, it's like this. And this is how you want your brain to be when you're doing normal things, watching TV, driving, having a shower. People that have panic attacks in the shower is just like this high alert, and it won't go back down, and that's why they're having it. So we need your brain to be like this and only be out full when there is something scary going on. So there are environmental types of anxiety, but the panic attack would actually go away if we dealt with it properly. Okay, thanks for watching. My next video is about if you've had anxiety for many, many years and you've had lots of therapy, how can you get rid of it in just a few weeks? How is that possible? And is it permanent? So we're going to discuss that in more detail. See you then. Thanks for watching.